During your menses, there are signs you should not see and there are signs you should see. So for the sake of this video, I'll be explaining the abnormal signs that people see during their menses. You know, how you can know you are having an abnormal menstrual flow, how you can know you are at danger of so many conditions through your menses. Number one of them is having too large clothes during your menses. If you're the kind of person that experiences too large blood clots, like bigger than a grape during your menses, then it's abnormal, and that shows you need to visit a gynecologist so you can have yourself checked before the condition, gets out of hand. Number two is having, feverish condition like cold, hotness of the body, headache, weakness during menses. This shows you are having an underlying condition. You might be having an infection in your body which needs treatment, and it mostly shows during your menstrual flow. And if you're having weakness, it shows maybe you might be having a low level of hemoglobin, and you might probably need to go for HB test so they can check your blood level, check your hemoglobin level, and offer the necessary medications for you so you will not be at risk of so many conditions. If you're a kind of person that do have irregularities in your menstrual flow, you're a kind of person that's like do see your menses within 21 days, 22 days, maybe 28 days, and all of a sudden the pattern of your menses changed. Like you start seeing that maybe 30 days, you start seeing it at maybe 19 days or 20 days interval, then it's abnormal. You need to have yourself checked so they can know what is wrong with you. There might be so many things that can cause this problem. It can be hormonal imbalance, it might be PCOS, polycystic ovarian syndrome, can be cancer. So many conditions like that can cause it, and that's why I said you need to have yourself checked so it can be managed when it's still at early stage. If you do experience so much cramping before your menses or during your menses, it's abnormal, because during your menses or before your menses, early before your menses, there's a certain hormone that is being produced called the prostaglandin hormone. So when there is an overproduction of this particular hormone, it can cause so much pains during your menses, and that's why you need to have yourself checked so that a necessary solution will be given to you. If you're always experiencing spotting before your menses, maybe early before your menses, and a kind of person maybe during you are in your menopause, you do experience spotting during your menopause, then you need to have yourself checked, because it might be cancer. I'm not saying it's cancer, but it might be, because there are other conditions that can make you to be having spotting during your menopause or after your menopause. And if you're the kind of person that is still seeing your menses, then you need to have yourself checked, because other conditions can cause it. Too much production of prostaglandin hormone can cause this spotting either early before your menses or during your menses, and that's why I said you need to have yourself checked. If you do experience missed menses, maybe you don't see your menses for like 2 months, 3 months, it's not normal, it's totally abnormal, and you need to have yourself checked so that the necessary solution will be given to you. If you also do experience menses that is less than 3 days, maybe you do experience menses of 2 days, above 7 days, the normal interval for menstrual flow is within 3 days to 7 days. So anything out of this range is totally abnormal. I mean, if you experience a menstrual flow that goes beyond 7 days, it's abnormal. If you experience a menstrual flow that's not up to 3 days, then it's abnormal as well. But if you're having a menstrual flow of 3 days and it's maybe to 7 days, it's still normal, it's still within the normal range. So you need to have yourself checked in case you're having any of these signs I've just explained. If you're always experiencing heavy menses, your blood is always rushing more than it should, your pad fill up in just an hour, you do have a pad that fill up in an hour, then it's abnormal. You're not supposed to have an heavy flow during your menses, because the flow of blood from your uterus is usually steady and not fast. So you need to have yourself checked in case you're having it. And at the same time, if you're having light menses, then it's abnormal, because you might be having a condition like endometriosis, whereby the content of your fluid, your menstrual fluid, goes back into your abdomen. And this condition is totally abnormal, and that's why you need to have yourself checked so they can screen out all these conditions from your body when it's still at early stage. If you're always having abnormal discharge, you have a discharge that smells, that have a kind of funny color, you might be having a discharge that look brown, or you might have a discharge that look red. It's totally normal during your menses. But anything out of this, you're having a green discharge, you're having a yellow discharge, a kind of pink discharge, it is totally abnormal. If you're having a pink discharge, you might be pregnant, and if you are having a heavy spotting, you might be pregnant as well. It is abnormal during your menses. So you need to have yourself checked so you can screen out all these conditions I've just explained. It is also important you note that the normal menstrual flows or the normal menstrual cycle spans between 21 days to 35 days. So if your cycle is out of this range, you do see a menses of maybe 20 days, your cycle is just 20 days, your cycle is 36 days, or 19 days cycle, it is abnormal. But if your cycle is within 21 days to 35 days, which means if you're having a cycle of 25 days, 28 days, 30 days, 31 days, 32 days, even 34 days, it's still normal. And if you're a kind of person that also experiences a cycle that changes, maybe last month was maybe 28 days and this month is now 30 days, it's abnormal. It is a kind of irregularity in your menses. I need to have yourself checked in case you're having this condition as well. But if it is steady, maybe you do have 28 days and your 28 days remain 28 days, then it is totally normal. So if you enjoyed this video, do well to hit on the subscribe button so you can be getting more videos like this. Thank you for watching this video. I'll see you next time.